Heart disease is the leading cause of death in the U.S., and chances are it will impact you or someone you love. Laura has that and more in tonight's Health Beat. Laura?
Well, Ashley, while heart attacks can occur suddenly, doctors say many people spend a lifetime creating clogged arteries. Fox 17's Erica Lathan has more on the anatomy of a heart attack.
It happens once every 20 seconds in the U.S. Someone has a heart attack. And that's where Dr. Howard Walpo comes in.
When these obstruct, this is what causes a heart attack. So it really depends on where the blockage occurs as to how large amount of muscle is involved and thus how big a heart attack we have.
But long before you experience chest pains or a heart attack, Dr. Howard Walpo says you may be setting yourself up for heart disease.
We actually have evidence of cholesterol buildup in arteries as early as in patients' teen years. And these plaques at that point obviously are not obstructive, but the process is beginning even when we're in our teens. As the years go by, the plaque can build, and it depends on how many risk factors that the patient has.
Those risk factors include a family history, a high-fat diet, high blood pressure, and cigarette smoking.
Smoking actually does two things. One is that the toxins in cigarette smoke damage the lining of the artery and make it easier for cholesterol to be deposited in the plaque in the arterial wall. The second mechanism that smoking causes heart attacks is it tends to make platelets in our bloodstream stickier. They tend to clump together easier and form clot.
This video from the cardiac catheterization lab illustrates a blocked artery. Next, you see what happens when a catheter is inserted. A tiny balloon is inflated to reopen the artery, and a metal stent permanently holds the artery in place.
If we can open the artery, once blood flow is reestablished, we're essentially stopping the progression of the heart attack.
But Dr. Walpo says well before you need his help, you can begin helping yourself.
Hopefully, patients will go to their doctors. They'll be screened for risk factors. If you're having chest pain that's not been diagnosed, don't just blow it off. It needs to be evaluated.
Erica Lathan, Fox 17 News.
Nationally, hospitals try to evaluate and begin angioplasty on heart attack patients in under 90 minutes from the time they arrive. On average, St. Thomas begins surgery in about 60 minutes, making the facility a leader in treating heart attack patients.